So what does this look like in classrooms where Buen Comienzo is being implemented? Well, the letters are pretty common across classrooms in general, but adding words, particularly interesting words, slightly more sophisticated words like entusiasmo, divisare, descender, that's a focus on vocabulary that we think is very important, and bringing kids back to focusing on learning these words and then representing that with the word wall. This is a commentary from one of the educadoras. Han mejorado el vocabulario, han ampliado su vocabulario. De hecho, ahora ellos están pasando a la escritura emergente. De hecho, es mucho mejor porque toman los cuentos de repente. Ellos solos ya saben el nombre, buscan en el muro de las palabras. All right, so the kids are actually becoming active agents in using the word wall and the books that are provided as part of the intervention, and which are available to them for use. So you often see in these classrooms that kids sit together and look at books with one another when they have free time. And this is the emergent writing, the pictures and emergent writing that children start to do when they have rich access to books in the context of an early childhood setting. So that was a quick summary of the research on language development and its relation to literacy development. Why do we worry about socio-emotional development? Well, once again, I think Maria Pedregal told us why we have to focus on emotional development. For children in these schools who are coming from families with high levels of stress and high levels of violence and with little support for optimal child rearing from social networks, socio-emotional development is likely to be problematic. Thus, what you see in children is a high risk of behavior problems. There are two major kinds of behavior problems that are visible. One is what we call internalizing problems, kids who are sad, kids who look depressed, kids who are too quiet and too shy. Those kids definitely need help and support, but the kids who are externalizing, they're the ones that really cause problems in classrooms. The kids who are hitting each other, running around, who won't sit quietly, they can disrupt learning for everyone in the classroom. And so helping teachers with techniques to address the needs of those children is very important, not just for their development, but for the development of all of their classmates. So these problems of, particularly the externalizing problems of behavior, have to be addressed. And fortunately, in the last several years, there is good evidence that there are techniques for addressing those problems, that they can improve the climate of the classroom to implement those techniques to help teachers understand what to do, and that the combination of addressing the socio-emotional problems of individual children and the climate, the affective climate of the entire classroom, combining that with interventions focused on language and literacy greatly increases the effectiveness of the interventions focused on language and literacy. So I think the fourth panel this afternoon, you'll have an opportunity to hear more about a very effective approach to improving socio-emotional climate and organizational skills of children in early childhood classrooms. So I won't spend more time or attention on it, except to point out that it's now well demonstrated, and it would have been a mistake to leave this out. One of the things we see in Buen Comienzo classrooms is attention to these issues of norms for classroom behavior and respect among children. So why do we worry about health in the context of what is essentially an education program? I should say that these slides that I'm going to present you will see they're much more sophisticated than the previous slides. That's because Mary Catherine Arbour and Carla Santis actually produced them, and I'm just borrowing them for presentation. But of course, we are interested in the health of children. We want them to be healthy no matter what. It's not just, it's a goal in its own right. And health is multiply determined. It has to do with biological proclivities, but also environmental factors and lifestyle, but also access to health services. And there are many risks for children in developed and developing countries. Overweight is one serious one, and overweight, even in very young children, is associated with problems of reading. Similarly, asthma, which is a frequently occurring problem in Santiago in the winter, is associated with problems in reading. And we don't know whether that's a direct effect or whether that's an effect mediated by absenteeism from school. But there's considerable evidence from the medical and the medico-educational literature that a variety of health problems are related to educational outcomes. Low birth weight, but also overweight and malnutrition, not just undernutrition, but also malnutrition, are all associated with poor academic outcomes. So one of the mechanisms for trying to intervene with these problems is regular medical visits to encourage families to and teachers to attend to the health status of very young children. And that's one of the targets of thinking in Buen Comienzo, of the health team, Mary Catherine Arbour and her team. In Chile, these problems, I should point out, are not insignificant, particularly obesity. These are data that go till 2000, and almost 20% of girls and slightly lower percentage of boys in 2000 were identified as obese in Chile. And the data that continue through 2006, a slightly more refined distinction, 23% overweight, and of those, 10% properly obese. This is a very serious health problem for 10 years down the road, because not only do these children have more trouble in school, but they of course have more health problems and an earlier predicted age of death. So obesity is one issue, and of course it is a question of lifestyle to some extent, and nutrition and opportunities for activity. But the other major focus of our attention in Buen Comienzo is respiratory problems, and in particular respiratory problems that cause parents to keep kids at home rather than sending them to school. This is a cultural issue, right? If it's early childhood education, it isn't really education. Who cares? You know, my child can miss. It's more important that if he's coughing, he stay at home with me. But one of the interventions that's very focused is to try to provide the teachers with mechanisms for helping children with asthma so that parents are willing to send those kids to school, but also providing asthma action plans for the children most affected by asthma. So early diagnosis, regular monitoring of symptoms, having appropriate medications in the classroom as well as at home, and having a long-term plan that coordinates what the family does, what the doctor does, and what goes on at school. So as to avoid these asthma problems that alter the possibility of children's opportunities for learning. And asthma can have many problems, not just those directly related to learning, but also they can undermine kids' access to physical activity, can be associated with depression and other attentional problems. So, in short, these health issues are absolutely crucial to ensuring, attention to these health issues is crucial to ensuring the effectiveness of the cognitive and language interventions. It means attention to nutrition and activity, but also attention to ensuring that the kids are being up to date on medical visits so that their health problems are identified early and that those with respiratory problems have more resources available to them than just staying home when they're symptomatic. See, that's the kind of thing I don't know how to do on PowerPoint. You can tell this isn't my slide. All right, so in the classroom, what we see is attention to issues of health in conversations with the teachers, presence of alcohol gel, little lessons reminding children to sneeze into their elbows and not into their hands, and so forth, that generally improve the quality of that improve the quality of the classroom environment as an environment where children can remain healthy. So, in short, UBC is a strategic and multifaceted alliance among many, many actors, the goal of which is to improve the quality of early childhood education. And to do so in the context of an evaluation, a rigorously designed evaluation, which will produce results that we hope will be of interest to policy makers in Chile and throughout the world, because it will be a truly unique source of data about impact of early childhood intervention programs. We have, I think, already achieved a lot of novel accomplishments in working together, in integrating health and education, in enriching language and convincing people that language is an important focus if literacy is to be the long-term outcome. But these 64 schools are really just an opportunity to provide a demonstration of the power of early childhood education when it's done right. I have not touched upon two very important aspects of this study because I didn't wish to violate the time given to me, and I'm looking forward to hearing our discussants. But let me say that there is a family involvement component to Un Buen Comienzo, and as I said, had we known quite how serious these family problems were, we probably would have made this richer and more intensive than it currently is. But there is good evidence that involving families in activities that take place at the school and that link what children do at school to what they do at home can be valuable, and we built on those findings in designing this family program. And finally, that the coaching professional development model represents what we know from lots of research is the best model for improving professional practices in schools. That there are many approaches to professional development that are totally ineffective, and talking to people about what they should do is one of them. Talking to people about how to do something different is the tiny first start to actually helping teachers who are engaged in an extremely difficult task of management and analysis and instruction to actually change daily practices. It's the coaching, the reflection, that the working together in teams at a school level that actually generates change. And this is the professional development model that people now would endorse as the right approach to permanent change. So I thank you very much for your attention and look forward to the discussion.